Stress can stem from various areas of your life. Exams, work, relationships, even good changes can throw us off balance. But in mental health, nursing stress has a more clinical definition. Let's talk more about this in this video. Let's first define important terminologies. Stress. It is your body and mind's response to change, especially when that change is threatening, challenging, or feels damaging. And when stress gets intense, it triggers anxiety, the inner alarm that tells us something's not quite right here. Defense mechanisms. It is an automatic psychological response that helps cope and reduce anxiety. It can be adaptive, helping us cope in healthy ways, or they can be known as maladaptive, harmful or counterproductive, interfering with an individual's ability to function effectively. Let's first start with green flags, the two defense mechanisms that are always adaptive. Altruism. Channeling pain by helping others. It doesn't just relieve stress, it heals. For example, a nurse who lost a loved one in a fire becomes a volunteer firefighter. Sublimation, turning unacceptable urges into productive actions. For example, someone fuming with anger hits the gym instead of lashing out at their boss. Now, onto yellow flags, the defense mechanisms that can go either way, adaptive or maladaptive, depending on how they're used. Suppression. This is the conscious avoidance, putting stress on pause, helpful in the moment, but not forever. Adaptive. You set aside anxiety from a friend's fight to study for your final exam. Maladaptive. You avoid that studying and just say, I'll think about that failing grade after I enjoy the weekend. Repression is unconscious blocking. This is when your brain quietly buries stressful moments and memories until they pop back up. Adaptive is that you unconsciously forget past embarrassment before a big speech. Maladaptive, you forget your dental trauma and keep skipping appointments. Regression, this is acting younger than your age, going back to childlike behaviors when the adult world gets too hard. Adaptive, a child wets the bed after losing a pet, temporary and age appropriate. While maladaptive of that is an adult throws a temper tantrum and slams doors after work stress. Displacement, redirecting our emotions, taking the emotions out, but hopefully on a punching bag and not a person. Adaptive, after losing a sports match, you hit the gym hard in hopes of getting better. Maladaptive, after you lose your job, you yell at your partner over dinner. Reaction formation, or overcompensating, showing the opposite of how you really feel. Adaptive, a smoker gives anti-smoking talks to teens while trying to quit. And maladaptive, you resent your dependent partner, but become overly controlling instead of addressing your feelings. Rationalization. This is excuse behavior. Convincing yourself that bad choices were actually logical. They probably weren't ready to date anyone, you say after getting rejected. Maladaptive. I drove drunk because no one else could feed my dog. Disassociation. This is the disconnection from reality itself. When reality is too much, the brain disconnects from it. Adaptive. You tune out noisy kids and traffic to focus on the road. And maladaptive. After a traumatic event, you forget your own name and identity or things that happened during that. Denial. This is complete rejection of reality, pretending the truth doesn't even exist. It's comforting, but dangerous long term. Adaptive is you say no way when you're first told about a serious diagnosis. Shock is normal. Maladaptive. A month after your child's death, you still insist that they're just away on a trip. Compensation. Covering a weakness. Turning weaknesses into strengths. Smart coping, but don't use them to hide. An adaptive way of looking at this is a teen with a disability excels in academics. And maladaptive, a socially anxious person dives into tech skills just to avoid people altogether. Finally, let's get into the red flags. These are defense mechanisms that are rarely, if ever, adaptive. Conversion. Stress becomes symptoms. The mind turns stress into physical symptoms of mystery illnesses, or you hear about bugs. You start thinking that they're kind of crawling all over you. Splitting. All good or all bad thinking. Seeing people as good or all bad, nothing in between. You call your nurse the only one who cares, then ignore him or her the next day. Projection. Blaming others for your own feelings. It's not me, it's you, except it actually is you. You're secretly attached to someone else, but accuse your partner of cheating. Now keep in mind, when used wisely, defense mechanisms can be life-saving coping tools that our body uses during stressful events. But if overused or used in the wrong situation, they can become a sincere problem to our health and well-being of others.
Thanks for watching. If you found this video useful, don't forget to like, share, and subscribe for more medical information, and to really help you on your next exam.